Welcome to sRNA Stronger Together. Today is Rare Disease Day, and we're so excited that you've decided to join and be a part of this event. My name is Lydia Dubose, and I am the Community and Volunteer Engagement Manager for the Siegel Rare Neuroimmune Association, or sRNA. If you haven't already, please take a minute for everybody viewing to introduce yourselves in the event chat and share what brings you to this event, what Rare Disease Day means to you, and your connection to sRNA. Today, I'm joined by Donna, Kira, and John for this community roundtable session. We'll be reflecting and thinking about the future of rare neuroimmune disorders. And we're grateful to you all for joining us. So Kira, John, and Donna, please take a moment to introduce yourself, share where you're from in the world, a little bit about your background and what your connection is to sRNA. John, would you like to go first?
Sure. My name's John Filchak. I live in Connecticut. I'm a public policy professional, I guess is what I call myself, for the past 40 years. I was diagnosed just almost 2 years ago with MOG. Sort of has changed everything for me and my focus and all. So it's been quite an adventure.
Thanks, John. Donna, would you like to go next?
My name's Donna Shaw. I'm in the UK, near Cambridge. I'm actually retired, although my background is a variety of things, publishing and teaching. I first went down with this. I got transverse myelitis November 2022 and was subsequently diagnosed with neuromyelitis optica, which was the cause of it. And like John, it's certainly been very, very life-changing. But here we are.
But here we are. And Kira, how about you?
Hi, I am attending from Saskatchewan in Canada. I am a pharmacy assistant, a student. I enjoy adaptive sports, but I'm here because I've been living with MOGAD and transverse myelitis since September 2022. I was almost fully paralyzed from about T6 down, but I've regained a lot of mobility, so I'm pretty proud of my journey. And yeah, sRNA has been a really important part of, I guess, early in my journey of learning more about my disease and making me feel more connected to other people with rare neuroimmune diseases, because otherwise I don't know if I'd meet someone in person with MOGAD.
Awesome. And welcome, Andrew.
Hey.
Sorry, I got you on here a little bit late,
No.
but if you would just introduce yourself and your connection to sRNA.
Yeah. Hey, thank you, Lydia. I just want to I was having technical issues and her leading the session and getting me in I really appreciate that. And that's testament to the team at sRNA. So my name's Andrew. I live in Baltimore, Maryland, but I grew up in Northern California. And I was diagnosed with neuromyelitis optica spectrum disorder in May of 2022 after my first attack. I'm actually a PhD student at Johns Hopkins University, and that was actually while I'm still a student, was when I had my first attack. And my care team there also was able to connect me with sRNA while I was still in the hospital, and just to sort of see about resources. And I joined the young adult support group, actually, where I met Kira as well. And that's how I've gotten more involved in this community.
Awesome. Thank you all for being willing to be here and share your experiences. It's truly shows how we're all stronger together. There's all these, different experiences, different diagnoses, different places in the world, but this community brings us together. So I'm just going to open up this question and y'all can kind of unmute and speak to it as you feel comfortable. But thinking about your journey with your diagnosis, what are some key lessons that you've learned? And, what's been a big help to you as you've learned how to live and find your kind of new normal and life after a diagnosis of a rare neuroimmune disorder?
Shall I go first? Well, a key thing I've learned, and also from talking to other people during this past year, is that prompt diagnosis and treatment, which often doesn't happen, I have to say, is absolutely key to recovery and how well you recover. I was incredibly lucky. My local hospital has a fantastic neuroimmunology team, and my GP was very good in sending me straight to A&E, which is emergency department in the States, so that from it first starting, 8 days from the onset of the pain, which I just thought I'd trapped a nerve or whatever, to hospital admission was 8 days. And within 4 days of hospital admission, I had started treatment. They still didn't quite know what was going on exactly, but within 48 hours of being admitted, I had gone from my limbs not working quite as they should to being completely paralyzed down my left side. And they obviously suspected neuromyelitis optica, and they sent the bloods away, but they have to be sent to a specialist lab in Oxford here, and they take some time. But in the meantime, they put me on the sort of standard treatment here, which is intravenous steroids, followed by intravenous IG, and hoped that would work. I didn't have Plex because that was decided against. I know we have slightly different protocols in the UK than you do in the States. And indeed, within a couple of days of having that treatment, I'd started to get tiny, tiny flickerings in my fingers and in my toes. So that was encouraging. And I got myself, they were very reluctant for me to go home, but I did get myself home just in time for Christmas, only because we'd been able to put in a stair lift, all the other things that go with being disabled. And basically I had to walk again. I've had to learn to use this arm. But here I am a year down the line, and I absolutely know that the reason I have recovered as well as I have is because of the speed of diagnosis and treatment. And I also know that there are many, many people, both in the States and in the UK, and at good hospitals, that don't get that. So raising the awareness for that is really, really crucial. So I will stop there and let others share their experience.
I would fully agree with that. When I had my initial attack, I went to a local hospital actually a couple of times and was sent back saying, it's a reaction to a vaccine that I had recently gotten. I kept deteriorating, and to the point where I actually had a stroke, and I was hospitalized locally. They ruled out anything neurological, and I was treated for meningitis for a couple of days. But thankfully, my doctors are actually in Boston. I was able to get up there, and they have a incredibly robust neurological expertise. So they quickly, got me onto first on the prednisone and IV on that, and then the blood plasma transfers, 5 of those. Now I do IVIG every 4 weeks. but I was 22 days hospitalized, and I think it could have been a lot shorter if there, if there was that knowledge. But unfortunately, there wasn't. They were trying hard, but if you don't know, you don't know. But since that time, I've really immersed myself in anything I can read on MOG. And sRNA has been, with your library and all, has been a tremendous help. Maybe know too much at this point, but I'd rather know more than less.
I think something that's been really important to my healing journey has been connection with others. sRNA has definitely provided a great platform for connecting with other people with my diagnosis, but finding in-person groups has been important too. I don't know if anyone else within my region has MOGAD, but trying to find other similar groups. For example, we have a group called Spinal Cord Injury Saskatchewan, and so they've been really important to connecting with. I attend like a women's group to be able to discuss kind of like womanly problems with spinal cord injuries. But I've even found like other groups have been open to me attending, such as MS. So I have quite a few friends in the MS community, and I find that they're very understanding to my troubles, and they want to learn more and such. And so it's been a very sympathetic, supportive group. So I would say I would encourage people who are feeling still a sense of loneliness, who maybe haven't found groups outside of digital groups, to try to connect with other groups that may be related, because from what I've found, they can be very supportive, even if they don't have your exact diagnosis.
Yeah, I completely agree with Kira. Like, just connecting with other folks, talking with other folks who are sort of in the same age group as me has been a huge part of like why I'm even here. I think I would also just want to add to like two things that I've learned in the last year and a half were that just as we always are sort of working on like relationships with our family at post-diagnosis, or friends who are now coming to know you in a different way, I think I've learned just the importance of building relationships with my care team. It doesn't, I think there's asymmetry in terms of like how much they know about versus you, and you can educate yourself as much as possible. But ultimately, like, your symptoms are your symptoms and your experience. But I think I've learned how important it is. I also am, so I'm seronegative for NMOSD, and I've been diagnosed with lupus and Graves' disease. And so about all these sort of autoimmune conditions, and I deal with a lot of different specialists. I'm in an environment where my specialists do communicate quite a bit, but I've often have to be sort of, I think, the captain of that ship. Which was a really uncomfortable space when I don't know that much about this illness, but I think I'm only able to navigate just, when blood work comes back weird, or, like, this medication isn't working that well for me, being able to communicate that across. And it's really iterative over time. Like, I feel like, they're trying to get me to trust them, and I need to trust them. So I would just say, like, continue to work on building that relationship with your providers, that hopefully it's beyond just like, oh, you're in here for 15 minutes and, oh, looks all good, see you later, but to really do the work of letting them know about things that are going on in your life as well, that could be also just driving factors in the symptoms. And then the other thing I also just want to say too is that I think is critical for us, especially like going forward, is like access to facilities. I'm in a position where like I can take like a free shuttle to like where I can get all of my care. And I know that I won't always have that when I leave where I'm at. And I think that that's something that has been access to facilities quick and easily was a huge part of my recovery. So.
Yes, it's quite interesting because we're all sort of saying a similar thing, in that I think, certainly from my point of view, I got, by luck, the most fantastic care and treatment. And I've got I will be forever grateful for that. But then I was discharged with nothing. no support, no pointers, absolutely nothing, to the extent that I have actually spoken to a specialist nurse and raised this, and she said quite openly that she doesn't do social media, but she understood that a lot of people did, and I've actually put together a list of where people can go, and she's very keen to have that. And this is the thing that's come back time and time again, is that people are discharged, but they've got no pointers at all. I mean, we've got the Transverse Myelitis Society here in the UK, which is really excellent. But I had to find that. I had to find all those groups. I'm quite tech savvy, but a lot of people aren't. A lot of people aren't on social media. So there is no signposting to support and other people. And it is a very, very lonely place when you're discharged. And I'll be quite open about the fact that I was in a very dark place when I came home. I could do nothing for myself. The shock and the trauma was beyond imagining. If I could have spoken to somebody like me who said, look, this was me a year ago and look where I am now, that would have made a huge, huge difference at the time. I've had to find that. And I hear that time and time again. And it seems to be, I mean, finding sRNA has been absolutely fantastic. But there should be, I don't know how we do it, but, you know, all the hospitals that are treating us should discharge their patients with at least say, look, you know, here's a list of groups that you can contact. That doesn't happen, and it really must.
I fully agree with that. And that was my experience as well. I get discharged. Okay, now what? And I was referred to an initial neurologist within that same hospital system whose specialty was MS, knew of MOG, but that really wasn't his focus. And thankfully, at that point, I had found sRNA and was reading more and more about it. And I kept asking him questions to the point where he finally said to me, I think we need to get you to a different neurologist who knows more about this. And readily transferred me over to another one who was had expertise in what I have. And that really changed the course of what the treatments were. And so you have to be your own best advocate on this and just keep asking questions.
Absolutely. Yeah.
Which is just critical to this. And have, in my case, my wife has been incredible. When I wasn't really in condition to ask questions, she's pretty dogged on those things. So you need to be an advocate. You need people around you to help, and don't be afraid to ask questions.
For myself, I was discharged from the hospital just about a year ago. And after that, I had outpatient physio. And following that, I was referred to a program that I don't know where I'd be without this program. It's offered through the health region, and you can get referred to it if you've been through rehab. And it's essentially a workout program ran by, they have an exercise therapist, an occupational therapist assistant, and a physio. So they help you to adapt gym equipment for, like, if you're in a wheelchair, or they also have some special kind of physio-like equipment. But I know it's a pretty new program. So if it was just a few years ago, I would have been in a similar place where I don't know what sort of therapy I would have had following hospital. But because of this, they've been with me every step of the way, and as I progress and learning to walk and such. So it's been incredibly beneficial, and it definitely pains me to hear that's not everyone's experience. But I think programs like that are much more needed and should be more widespread, because otherwise people's rehabilitation journey can definitely be cut short.
And I think along with just kind of a huge part of my rehabilitation was being connected with like a rehab therapist that I could talk like a psychotherapist to really sort of process kind of the trauma that Donna has like talked about. I think each and every one of us like after that first attack or if you have a relapse. But I think even also just in living with like the uncertainty, if it's a relapsing condition, I think that really, I had like a really hard time, like after like I was discharged and I was in the middle of moving. So my lease ended on my apartment. So I was like discharged from rehab and expected to be out of my apartment in 2 weeks. And so actually while I was in inpatient rehab, we were trying to find me an apartment in Baltimore that, I was on a third floor walk up, which was just like not going to happen anymore. And so I'm totally with you, like Donna, around what can hospital do to really sort of think broadly about like what this person's needs are going to be, and the things that they had before, they might need other things now. And so I do agree that this sort of like ongoing care management or care coordination is like really essential for folks as they kind of navigate how to live differently.
Yeah.
I think I along with just like I think having access to just like a rehab psychotherapist or even just any therapist who's really understands like what it's like living with a chronic illness or dealing with like new diagnosis is really essential for folks, and that should be really also just part of care afterwards. But I think that's also allowed me to get to a place where in dealing with the uncertainty about relapsing or trying to figure out like, is this a symptom of like a relapse? Like what's going on? Like, is this happening? Is I've learned a key part, and I'm still learning this, is like how to approach a lot of this uncertainty with curiosity about myself. And that I think that allows us kind of, as John was saying, to ask questions like, hey, I'm kind of feeling this in my body. Is this something else? And I think I've become a much more curious person. I mean, that's the reframe I think that's been helpful for me around either what I'm eating or just like how I'm living my life. What are my priorities in my life? And to really, I think that that's been a key part of my recovery and learning to live as I am, given all of these things, is like, how do I approach and reorient myself around living with this rare condition or the unknown of it with just more curiosity about life.
Yeah, I understand what you say about, having a relapsing condition, and, is this just a normal sort of normal inverted commas neuropathic pain, or am I having a relapse? That's really quite tricky to navigate. And I sort of, the pain is always there, it never goes. But some days it's very much worse than others. And I think, oh God, am I having a relapse? I sort of self-triage myself the whole time. And I think, no, I can still move everything, even if it's painful. I'm not getting any numbness anywhere, just, hold tight. So I haven't actually taken myself off to hospital in a panic yet, but and I like you say, Andrew, you do start to read your body a lot more and become very much more self-aware, because you have to, because as you say, you've got to advocate for yourself the whole time, and that's quite a challenging place to suddenly find yourself in virtually overnight. But the other thing I wanted to say was about physiotherapy, which is just absolutely key. It really is. Over here in the UK, it's slightly different. I was referred to the community physiotherapist, but obviously with funds being the way they are and demands on their time, the community physiotherapist didn't materialise until I'd been home for about 4 or 5 months, I think. I, in fact, in hospital, knowing how serious this was, I had already made contact with a neurophysiotherapy group that I knew of, and I was in the fortunate position of being able to do that privately. So the minute Christmas was out of the way, I had my first appointment with her, and she's just been absolutely amazing, and I'm still continuing to see her. I see her 3 times a month, and I don't think I'd be where I am without physiotherapy in place. But I think for people who aren't in that fortunate position, what on earth do they do? It's it's scary, seriously scary. But again, here in the UK, we've got a chap who developed transverse myelitis, I think about 3-4 years ago. I'm not sure now, but anyway, he was very seriously ill, but has recovered, and he wanted to give something back, and he has an amazing fundraising project, and he's raised loads of money, and he now gives grants to people in this country who need physiotherapy, but nobody knows about him. You know, I know he's helped two or three people that he's helped, but so many people aren't aware that that resource is available to them if they want to apply for it. So everything, all the information is so fragmented and nothing is pulled together. And that seems to me to be the case both here in the UK and in the States.
There's so many resources and so many parts of the experience that you've all spoken about. There's the physical recovery, the physical response of working with your medical team, and then the emotional side of coping with your diagnosis, learning to live with your diagnosis and all the different ways that shows up in your emotional and mental well-being. So it sounds like there's a lot of similarities between you all, and you all had great advice related to each of those. Is there anything before we move on else that y'all would want to share about tips for those who maybe are earlier on in their journey or who aren't in the place that you're at currently?
I'd maybe like to touch on something that Andrew briefly touched on, and just like learning to live with your diagnosis. I think some of the best advice I received early on was to not focus too much on the past, and not as in like grieving is important and it's healthy, but like constantly wishing for the way things once were isn't necessarily helpful. So what's a way to, I guess, look forward? And I guess for me, that's been practicing gratitude and focusing on what my body can do versus what it can't. And so how I've learned to practice that, and like this has been very helpful with my trauma and coping every day, is just trying to gently rewire my thinking. So, you know, pretty much every day I'll have like a thought, for example, of, you know, I really wish I could do a challenging yoga session, and that's something I can't do any longer. And I allow myself to acknowledge that, like that's important with grieving, but then I try to follow it with a positive thought of, okay, maybe I can't do a yoga session, but I am strong enough now that I can do my favorite yoga pose. I can get into a forward fold. So trying to acknowledge, like, you know, those difficult feelings that way has helped me so much in regaining positivity, and it becomes more natural over time. And like I said, I think it really helps me focus on what my body can do. And so I'm just still so grateful to have some level of functioning.
I think that's a great point. And, you know, early on when I was back circulating in work and seeing people, you know, one of the things I'd hear more often than not is, so now you're cured. And you know, and you give your explanation about no, you're not, but in your head you're saying, you know, what is there going to be another attack? And moving that was difficult in the first many months after the diagnosis and getting back around it. It's easier now because I've been able to process it better, but I have to say that was a real challenge to move forward, which I think I've done a better job at this point. But, you know, in the back of your head, you're saying, well, what's going to happen tomorrow? So it does change your outlook.
Yeah, the other thing I would say to anybody who's very early on, in their diagnosis, is it is amazing what the body will do and how it can recover. And you're in whatever situation you're in, and you just cannot imagine ever being able to do anything normal again. And it will come, and obviously the more that you can help it by doing physio and things like that, the better. But the body will heal. You won't necessarily be exactly as you were before, but you will still be able to function in a way that at this point you might not be able to imagine, and you must really hang on to that, because it is a fact.
All great nuggets for folks who can learn from your experiences, and thank you for sharing. So shifting toward, we've been reflecting a lot on your experiences and a lot on the past, and now I want to shift us to looking forward a little bit more. Kind of looking at the big picture of the rare neuroimmune disorder community as a whole. What are some of the ongoing needs that we as a community should focus on? I know y'all have already voiced a little bit of, the medical system, being able to have resources that people are handed as they're moving on from acute care or from rehab. But what are some of the ongoing needs? You can reiterate ones you've already mentioned, or what are some other ones that haven't been discussed already?
Well, on the wish list, there are things that one might be able to achieve or improve. There are also things that might not be possible. But on my list, I've got effective pain relief for neuropathic pain. Because there are so many different drugs out there. It's so individual, and nothing really seems to work. So I would like personally, and I know I'm not alone in this, would like to see much more research into that, because living with neuropathic pain, I've discovered, is a whole different ball game to anything else. It's not just taking a couple of paracetamol, it's something else entirely. So effective pain relief, I think, would make a huge difference to an awful lot of people. And obviously a cure, in inverted commas, for NMO. And also more generally, because we have this specific condition, but we also straddle all sorts of other things as well, in that we tap into the spinal cord injuries community, which could have a spinal cord injury for any number of reasons, but nevertheless we can still take a lot from that. And one of the things, and I know there's research going on in this country under the multiple sclerosis banner, but myelin sheath repair and research into that, which I know is going on, because that could make a huge difference to all of us and other people with spinal cord injuries. If we could repair the myelin sheath, would make a huge, huge difference. So that's my wish list.
That's great. Research to be done.
Yeah.
I think, making sure, thankfully hasn't been the case so far with me, but to enable the physicians to, if they decide on a treatment path, that to not be encumbered by the insurance world. And I know that the more I read, that seems to be for a spectrum of diseases, especially when there's no approved treatment, as is the case with MOG and others. I think that's one that needs to continue to be worked on. But and also, with my experience in a small hospital, and I know, it's a rare disease, but I keep going back to, if it had been caught, what can be done so that, rather than just simply the test and say, well, it's not MS, so it's not neurological, which is essentially what happened. Is there some other, additional, means to get them to dig a little deeper? so that we can get the treatment. If I'd been put on steroids immediately, might have been it wouldn't have changed the diagnosis, but it probably would have changed spending 22 days hospitalized. So, I'm not sure how that would occur. My primary care doctor didn't know what I have, but she's educated herself on it, and she's become a real champion for me. And looking at all the test results and all, and discussing it with me, and really giving that 30,000-foot view of what I've got, in addition to all the great specialists I have.
This is tapping into the need for much greater awareness, both within the medical profession and the general public as well. I'm not making comparisons or disparaging them, but if, somebody gets a diagnosis of cancer or stroke or whatever, and you tell somebody that, they immediately get it. Plus the fact that there's an awful lot of support out there, but you tell somebody that you've got transverse myelitis and neuromyelitis optica, they just look at you blankly. There just is not the awareness out there. So, but that includes the medical profession as well, because I know that statistically a GP might see one case in his whole career, maybe not even that. An awareness raising campaign, I think, is on the cards.
My personal hope is to one day be able to connect more regionally with people with MOGAD. I haven't found any group that represents MOGAD within Canada. And excuse me, although I feel very, digitally supported through sRNA, it would be really nice to be able to connect with people who I could discuss common challenges, I guess, with like healthcare. I'd like to learn more about what people in other provinces of Canada, how their healthcare compares to mine. So I don't know what the disconnect there is, if there's just like not enough diagnosis within Canada, or we're just too small. But some way to connect with people when there's not enough of us to create like a larger support group would be really nice.
I think for me, being like a double seronegative NMOSD, I think has made it even harder for me to sort of think through what my prognosis is, and even get kind of that uncertainty. And it sounds like probably in the next like 5 to 10 years, we might identify and figure out there's like a lot of momentum to kind of figure out what's going on with those who are double seronegative. And it's quite possible, soon it might just be in the same way that we found out about, MOG, that it'll be something else, and we'll be able to maybe better classify and figure out treatment options and prognosis for those like me. So that's been like kind of my big hope in this. I think, and I think related to that, and this is just maybe particular to me as well, is I because of this sort of uncertainty about like, well, how do we treat this? We're not really sure for those who are double seronegative. Like I'm always worried about the way that I'm like overutilizing services, right? Like I'm going in and getting tested for like a lot of different things, and other things end up popping up for me that lead to like other paths. Last year, like regular blood test for something led to, let's just do a scan. And then we did a scan, and of course you find something. And that just led to like this sort of snowballing effect of around like me being just in all these testing, even though symptomatically I felt okay. And so I think just, I don't know. I mean, some people would argue like, well, that's great that you're getting all these tests and they're actually investigating, because I can't even get them to investigate. But I think just somewhere in between that, because I found that the more that I just like continue to interact in these sort of healthcare systems, that they're just going to continue to find more and more and more, rather than like sort of taking a symptom-based approach around like, what do I actually care about as a patient to live my life, rather than me just making appointments, doing like really intense scans, so that, you know, like what is most important to me as like a patient, so that I can continue living my life. And if it's managing symptoms like pain, 100%, that needs to be like the priority, so that you could just do the things you want to do, or access to like devices that allow you to do activities that you want to do and grow in that way. So I don't know, that's like kind of my thought, especially because, you know, we're heading in a direction where like we just have more and more advanced technology that we can just like use and use. But to what extent is that like actually helping us to live the lives that we kind of like want to live? And I don't want to interface entirely like within this like healthcare system all the time. I want to spend more time like outside of it. So, and I think the more time that I do spend in it, the more that I think about myself differently. It's just like always sick, or as like always a patient, and I'm trying to like move and imagine myself differently. So that's, yeah, that's been something I think a lot about in terms of the future.
I think too, we also have to hang on to the thought that we are, in inverted commas, some of the lucky ones, in that it really wasn't that long ago, 10, 15 years ago, that we would quite possibly have been diagnosed incorrectly with MS, for example. I mean, it's only very recently that the aquaporin and MOG antibodies have been discovered. So, you know, it's only about the last 15 years, I think, that they were discovered. I think I'm right in saying that. And that was a huge, huge thing, you know, to identify NMO as it has similarities to MS, but a quite separate condition. So obviously there's much more research to be done, but we are in a more fortunate position than perhaps people would have been 20, 25 years ago. As one of the professors who was looking after me said, he was on the research team, and he said, we do know so much more now than we did not very long ago. So that's something that we do have to hang on to. And also tap into that knowledge as well, which I know everybody here is doing, but that's really crucial that we do it for ourselves.
Yeah, it's amazing to look back, and that's something we're doing in a big way this year with sRNA's 30th anniversary, looking back on the past 30 years and how far we've come. And Donna, that's such a good point to remember to look back and to have that perspective. And then too, we're looking forward to the next 30 years. What do the next 30 years hold, and what changes will be made in the future? And a couple of y'all had already mentioned, you know, what you're hopeful for the future, but do y'all have anything else to add about your hopes for the future?
Just to carry on improving. I mean, I'm sort of 14 months down the line, and the recovery window is sort of the first 6 months you make the most recovery, but the recovery window is actually 2 years. And I have to keep reminding myself that I'm still well within that 2 years. And the body does go on repairing itself. You know, we have to remember that. And then, and the more we make our bodies do and encourage it, then the more we will improve. It doesn't just stop, it does continue, and we have to remember that, and also pass that on to others as much as we possibly can.
Yeah, I'm looking forward. Actually, in 10 days, I'm going to actually meet people that have MOG. You know, I've done, as you say, the digital meetings, and that's fine, and it's good, but I've never ever met anyone with it. So that's going to be that's sort of exciting to me. Actually, have a conversation with individuals, and that you know, where you can actually, you know, have that up close and personal interface. Because you know, Zoom is great, but it's not the same. And I'll just say too, when I get my treatments each month, I get the blood tests, and I did have one that had an abnormal result came back. I have to say, there a little bit of panic came in that I'm not going to go to a local hospital because they don't know what I have. So I made a decision to go into Boston, into an emergency room there in coordination with my doctors. It turned out to be just an abnormal test, but there was that couple of hours of sort of internal panic of, what's going on here? Is this something compounding with what I had? It turned out to be nothing, but it's a little bit of stress.
You don't need stress because that triggers your symptoms again, doesn't it?
That's right. Well, I was actually on a golf course when I got a call and said, I need you to get to an emergency room. I don't play golf like I used to after this, but I keep trying.
Yeah, no, when you get a call from a doctor, they're calling you rather than you like, hey. It's like that's really scary because
That's right.
especially for me also like I almost like got rid of like the my chart to like access my blood test results. Like you get a notification as soon as like you go get blood work, you can kind of like not feeling that great, you get the blood work and you get the notification, and then you see the blood test results before your provider has a chance to review, and you're like, oh my gosh. Just like you're in panic mode, and then they say, you know what, this is okay, let's retest this like next week. You're like, great. Like, and that can mess up your whole day. And so I'm totally with you. Like I had to say, like, I can't see these results before my provider does. And I think it's important to stay informed. I'm with like all of you, right? Like I think most of us in the rare disease community, like we want to be like we have to be we feel obligated to be the experts. We know that we're interacting with providers who don't know what's going on. And yet sometimes I don't like being so informed and so aware, like, and ahead, because again, it's nice. You want to be the captain of your ship, and sometimes you just want to let someone else kind of like take over for a little bit for you. And I think just sort of navigating that's what I hope to do over the next 30 years. Like I'm, for myself, like I'm looking forward to living, most of my life post, like after having this attack, right? Like, and trying to imagine what that looks like for myself. And, maybe we will see a cure. Like, I think that's actually very like the way the technology is working. Like we might, I mean, I'm totally, it's hard for me to imagine that we wouldn't, given just everything else that's just advancing with like, but I really do hope that I am like able to kind of navigate this like ongoing testing, ongoing sort of how I navigate the uncertainty is what I really am like hoping to be better at over the next 30 years.
Yeah, I mean, my chart is truly wonderful, but it is, you're quite right, it's very much a double-edged. I'd much rather, I'm very glad we've got it, because I know of other people who just cannot get hold of their medical records of any sort whatsoever. But the flip side of that is you're lying in hospital getting increasingly paralyzed, and your results, as you say, are coming down the phone and your doctor hasn't even seen them. But
yeah,
but it's a wonderful resource. We're very lucky, those of us who have access to my chart, I have to say.
one tip that I would give and follow is I try to avoid a Friday appointment, so that when I get that result and I have to, it seems like it's always a 3-day weekend, and waiting till Tuesday is not
Yeah, it's no fun. No,
not fun at all. So I'm definitely a Monday through Thursday person on those things. Yeah.
Another tip I'd pass on, and I don't know, I have no idea whether this would work in the States or not, but out of the Transverse Myelitis Society here in the UK, very recently a WhatsApp group has developed from that, which one of the members very kindly agreed to start. And it's only been going, I don't know, 6-7 weeks, maybe 2 months. And that has been an amazing resource. I think there's only 24 of us on it. Obviously, we're all in the UK, but so many of the people have said this is fantastic to have this, because they can fire off a question, immediately get information back from other members of the group as to what's helped them with that particular thing. And that has proved to be a really amazing resource. And also, they don't have to wait to the next month's Zoom call. So, you know, if you can find people in your area, Kyra, for example, you know, you would like to find people in your area with MOG. And if it is practical to set up some sort of WhatsApp group, I mean, obviously it can't be too large or it would be unwieldy. That has proved a fantastic resource for us here in the UK. So it's just something worth thinking about if you do find those people.
This has been awesome, and so much wisdom, so many good tips and advice and sharing just between each of you. And this has been just a wonderful conversation. And I appreciate you all sharing and reflecting and hoping and envisioning what can be with us. So it's been fantastic. In our last, just couple of minutes here before we move on to our next session, do y'all have any final words to share?
Just onwards and upwards.
Yes.
Yeah, you got to keep going forward, and I'd say in some ways it's an odd thing to say, but I'm a little bit more at ease with myself with the diagnosis, or maybe I've looked more inward, a lot more optimistic, I guess, going forward than I thought I was going to be when this first came out. So it is, initially you could say devastating, but I think I've moved on from that state. It's always there. I think there's reason, there's reason for hope for the cure and better treatments, and I think just going forward positively.
Wonderful. Well, thank you all so much. Thank you, Kira, John, Donna, and Andrew for taking some time to chat and share with our community.